Hello, I'm Dawn Durham, and welcome to PaTTANpod. Today we're talking about the intersection between pediatric traumatic brain injury and the juvenile justice system. Joining me on PaTTANpod is Dr. Kim Gorgens, a professor in the Graduate School of Professional Psychology at the University of Denver. Thanks, Dr. Gorgens, for being with us today on PaTTANpod.
Thanks for having me, Dawn.
Just so we have a better sense of the connection between these two components, can you share with me what are the current rates of TBI, or traumatic brain injury, and that have been discovered in the juvenile justice system? Where are we seeing the connection here?
Well, you see an extraordinarily high overrepresentation of traumatic brain injury history in juvenile justice and in the adult criminal justice system. Statistically speaking, and some of these data are ours here in Colorado, some are a colleague of mine there in Pennsylvania. Drew Nagel is doing a lot of really groundbreaking work in juvenile justice. But statistically speaking, in jail settings, so in corrections, in juvenile corrections, the rate of traumatic brain injury history is about 67%.
Wow.
And if you think about for the general public, for kids, that number is closer to 4%. In probation settings, so this is community corrections, here in Colorado, our rate ranges between 18 and 30%, which makes sense, likely that the rate is slightly lower for sentences that are less severe, folks who haven't managed to wind their way through probation or fail probation and end up in juvenile corrections. So the statistic that you hear most often across all settings is about 30%.
So we're talking about, when we think about kind of a generality statement, we're saying about 30% of those within the corrections pathway have a traumatic brain injury.
In juvenile justice settings, that number is even higher in adult offenders. So there's something, there's a unique vulnerability for kids, obviously, and we can talk more about that. But the rate at which people get themselves into trouble for injuries they sustain as kids and end up in the adult criminal justice system is pretty stunning too. That number is about 50 to 80%.
Wow, it is a stunning. I don't think we've ever really looked at it in terms of numbers. And when you say it in that way, it really kind of makes you pause and think, well, we may need to be thinking about the pathways here for a child or an adolescent with a traumatic brain injury versus without. And I think I'd kind of like to head in that direction with our conversation. Are there differences in the pathways with a child or adolescent who has a traumatic brain injury versus one who does not?
Well, I think there is a really complicated pathway for kids with brain injury, and a lot of your listeners will recognize this, and that is the accumulation of risk. And by that I mean, this is all chicken and egg, but the relationship between traumatic brain injury history and substance abuse, for example, the relationship between traumatic brain injury and psychiatric illness or mental illness, the relationship between traumatic brain injury and behavior problems, bullying, being bullied, suicidality. It's all of those things. And again, chicken and egg, right? So it's hard to pinpoint what confers a risk for traumatic brain injury, and the risk for developing these conditions after traumatic brain injury is much higher. And it really is a combination of all of those things that lands kids most likely in criminal justice.
So when we think about that it's so complicated, it's such a complicated pathway, if you will, and we're not sure, which one comes first. Is it is the injury stemming something? Is it a manifestation? Is there, at what point does the injury occur in the child's development? There's so many factors to think through. But when we think about knowing that it's so complicated, but I want to go back to that high percentage of students or of children and adolescents in the juvenile correction system with a traumatic brain injury, we have to think critically about this. No matter what the percentage is, we'd want to think critically about it. But with such a high percentage, I think we do need to be very mindful and thinking through what that may look like and how we go about our system. So I want to ask you, do we know and maybe we don't. Do we know any preventative measures that can be taken within the criminal justice kind of outcomes that are possible when we think about someone with a traumatic brain injury versus without? Do we know a way to prevent this? Do we have a plan? What do we do?
Dawn, this is such a great question. And there's so many great minds in this space. So I always feel good about doing this work because I'm alongside really terrific colleagues who I know are capable of changing the world. So I feel pretty optimistic about it. But your point is, at what stage or at what point do you intervene? Where's the sweet spot for intervention? And the really terrific thing about juvenile justice in particular is that there's all these opportunities for intervention. So obviously, and you, I'm sure, talk a lot about this on PaTTANpod from a primary prevention angle with helmets and safety equipment and being seat belted and smart bike riding and all of the above. So preventing the injury in the first place. But from a secondary and tertiary prevention standpoint, intervening as soon after an injury is identified as possible to provide the kinds of supports that minimize the likelihood that you have all of these negative outcomes like mental illness, substance abuse, lack of family support, right, for families who don't have the information that they need, learning problems, that you give the teachers the tools. This is what Pennsylvania is better than anyone with Brain Steps, right? Give the teachers the tools to keep kids supported in the classroom so that you don't add academic failure and peer rejection to the mix. So you have this opportunity at the time of injury. And then the work that I do in criminal justice is so far downstream of that injury. But this tertiary prevention model, which is, okay, here's a kid with a brain injury history and a drug abuse problem and depression and a suicide attempt history. How do we keep this problem from getting worse? And what we're finding, and this is the role that the brain injury plays, interestingly, your listeners will know this better than anyone. This is like the most novel concept for our community partners, but we're not treating the brain injury in criminal justice, but instead we're trying to assess a little bit of cognitive function so that we can make recommendations for how to accommodate those learning differences in therapies. And we're identifying a really severe problem. These kids are in a lot of trouble. Their families are oftentimes in chaos. They're at tremendous risk for continued poor outcomes. And we're working really hard to give the professionals, the treating professionals, better tools to do the work they need to do.
So if I'm listening here, we're really looking at kind of two pathways, a more of a preactive approach and a reactive approach. So preactive is preventing the injuries as much as we can, as you know, as best as we can, and educating children and families how to prevent injuries like a traumatic brain injury. But then once that injury occurs, I'm hearing you kind of say it's like a two-prong approach, that the immediate intervention. Okay, we had the injury. How do we accommodate immediately? What do we put in place? What do we learn? How do we assess? What do we take care of? And then down the road, much farther down the road, is when we do recognize there is something that is causing some behaviors that are unwanted behaviors. How do we figure out what's causing them, how to intervene, and how do we take care of that kind of quickly versus recognizing it and saying, oh, that's a shame.
Right, exactly.
Catching it before it has to get even worse down the line.
That's right. And the kids that end up in juvenile corrections, so this is, they've burned through community corrections, their longer term outcomes are really dire. And that's true for kids with brain injury history and kids without, right? It's hard for them to untangle themselves from the justice system as they move into adulthood. So the stakes are so high for us to get this right for the younger offenders.
So we really want to focus on intervening when they are adolescents, because as you had just pointed out, once they get to adulthood, it's not that it can't be intervened, but it's just that much harder and that much longer of a process. And so if we can intervene immediately after the injury occurs and catch it before it gets to a point not of no return, but a point where it's so much harder to kind of pull back on the right path. That's what I'm hearing you say.
That's right. Absolutely.
So let me ask you this, Dr. Gorgens, and I think this is perfect for the conversation we're having. What should we know? we are educating about preventing traumatic brain injury, right? You said it. We're teaching kiddos to put a bike helmet on. We're saying, be mindful of where your surroundings are. Be cautious. Be a kid, but be mindful of what's happening around you so you don't end up with these kinds of injuries.
Right.
What else? Is there anything else we can be doing to prevent this?
I think we're doing such incredible work in the primary prevention area. So that is helmet campaigns and heads up football training, a different style of play for contact sports. We're really, I think, riding a wave of tremendous momentum in the popular media and lay opinion, which is that we should do better to protect kids' brains in the first place. Yeah. And one really important message that, again, your listeners appreciate is that we're not talking about a single mild injury contributing to any of these outcomes, right? So kids with really good brains will have really good outcomes after a single mild, uncomplicated injury. So identifying kids with more severe injuries, or for whom this is not a first injury, or for whom they have other complicating factors, right? Other health conditions, other mental illness conditions, other substance abuse conditions that predate the injury, recognizing who's most at risk for poor outcomes, and really focusing our relatively limited resources on those kids. That's, I think, where the pivot is beginning to happen in the field, right? That we're getting better at selectively deploying resources to get a maximized effect.
So looking at those students who have a much more severe brain injury or multiple injuries, or have a brain injury that's kind of comorbid with other factors that would certainly play into it.
Yeah.
And you mentioned, the smarter playing football, and I think there is a platform there. We do see a lot of people on the professional stance there that are saying, hey, there might be, we got to look at this. We can't keep having these folks one injury after another. There's going to be consequences. We've seen there be consequences. And so you are seeing that kind of trickle down into the younger ages, particularly, and I mentioned football because it's probably the most common one we could think of as sports related, right? We hear about it so often. But I think you are seeing that trickle down effect to be more preventative or to catch an injury immediately so that we can intervene right away.
That's right.
So I think that's a good path we're on.
It is. And your point about the unwitting spokespeople for brain injury and long-term poor outcomes. So some of the more notable, let's say, retired NFL players who identify themselves as having memory and behavior problems. Everything in the field says we need to push as far upstream as possible. And that points to better intervention for kids after injury and preventing second, third, fourth injuries, right? Being really deliberate about better protecting kids' brains and then better protecting the brains of kids who've had an injury.
Yeah, I think that's a good conversation to keep having, right? How do we continue on this path? We seem to be on a good push. And unfortunately it came about in a not so positive way, but we are on a better path now of understanding what we can do to prevent or intervene immediately after an injury. And as you had said, to kind of prioritize almost. Where's our most severe traumatic brain injuries? Where are multiple traumatic brain injuries? And what are those factors that would impede even a more mild traumatic brain injury? Where are those factors that would kind of make it a little bit more severe of a case?
That's right. That's right.
Well, Dr. Gorgens, I'm so glad that you visited PaTTANpod today to talk about this. I think this is a topic we do need to be having a conversation about, and really thinking about that connection to the juvenile justice system puts it in a way where you kind of get chills up your arm saying we have to do something. We can't allow these paths for our adolescent students. We just can't allow it. So I'm glad that you were able to talk us through that. So thank you so very much for that.
Dawn, I'm so glad to have the conversation and really excited to play a role in the really remarkable work that you guys are doing there. A huge shout out to the Brain Steps team. I think if each state had a Brain Steps team, this conversation would sound very different, right? We wouldn't see the kinds of failure rates for kids, academic failure rates, social failure. We'd be having a really different conversation.
Yeah. Well, on behalf of everyone, I'll say thank you for that compliment. We appreciate that. Let me ask you this, and we ask this of all of our PaTTANpod guests. You know, we really want to inspire others to grow. What advice might you offer to those in the field to help them grow educationally in their own knowledge?
Oh, God. Well, I'm sure this is true for everyone, but here's what I love about the study of brains and brain injury and dementing disease and aging-related disease. That field is exploding so fast, and it's like a high-speed bullet train, right? To try to stay current with the literature and the work on the brain in our gut and the brain in our skull, and understanding the immediate and long-term consequence of injury and inflammation, for example. It's a tremendously exciting time. And so for anyone who gets kind of jazzed about geeking out on the science, I think there's never been a cooler time to dial into the research. But more than anything, everything points to, as we understand more about injury, we get more control over what we can do at the time of injury. So I think we'll see really seismic changes in the next 10 years about how we behaviorally and from a lifestyle perspective manage injury and mitigate some of these longer term negative outcomes. And I'm really excited about it, right? It puts treatment squarely in the wheelhouse of teachers and paraprofessionals, and this is like school nurses and athletic trainers, right? These are the folks who are actually going to be treating the injury in a way that we haven't seen to date.
So it is an exciting time, and it's an exciting time to kind of get on this train and as you had said, to kind of geek out about the research. But even if you don't want to geek out about the research, recognizing it's out there and that it's always growing, and we can do something about that research now.
That's right. That's right.
Oh, I so appreciate that. Again, thank you, Dr. Gorgens, for being with us. We're so happy that you were able to visit us today.
Dawn, thank you so much for having me. Really, it's such a pleasure, and you guys are doing the best work. Thanks for sharing it. Colorado's lucky we have our Brain Steps program modeled on yours. And like I said, we're representing here and hoping other people will do the same.
Thank you so much. Thank you to all of you in the field. You inspire educational growth in your students every day. A special thank you to John Ragsdale for producing this podcast. We'll see you next time on PaTTANpod.